So this video I wanted to talk about hypermobility, specifically 7 common myths I frequently hear in practice from patients that can lead them to not getting the care that they really need and not getting the results that they really could as well. So we're going to go through all 7. Number 1, this is the one I would start with being a chiropractor, is, if you're hypermobile, you shouldn't see a chiropractor. You already move too much. Now that's kind of true in that you shouldn't see a chiropractor who only adjusts you. If you're going and getting your back cracked every time, and that's all you're getting out of it, then that will give you some temporary relief, but it's just going to come right back because you need a more comprehensive approach. You need things that are going to help deal with the underlying issue and not just treat the symptoms of things feeling stuck because the muscles are really tight. So this is a myth in that you shouldn't not see a chiropractor, but you need to see somebody who does more than adjust. They should give you a comprehensive plan. If you just go there and keep getting cracked all the time, that's not actually dealing with the underlying problem at all there. So myth number 1, you shouldn't see a chiropractor. Depends on the chiropractor. Number 2, if you're hypermobile, eventually you're going to need surgery, hip replacements, you'll end up in a wheelchair. That is not true for the vast majority of people who are hypermobile. Yes, there are people who have. However, what most people don't understand about hypermobility is it is a spectrum. And it's only people who end up down the really far end who are likely to have that. And even then, many of them don't actually need it. The vast majority of people at other points of the spectrum don't end up needing surgery, don't end up needing wheelchairs. With the right care, they can live full and active lives and not have this be something that really, creates long-term issues down the road for them. So myth number 3, it doesn't really affect the spine. I hear this more from healthcare practitioners. It's easier to spot in the arms and legs than the spine, but it is not true that it doesn't affect the spine as much. Hypermobility in the spine is really common. You just have to know how to spot it. Most of the common tests only look at the arms and legs, and that's the easiest place to see it. So if you have hypermobility in your arms or legs, there's a good chance that you want to work on the spine as well, but that doesn't mean that it's just as easy to spot. So some practitioners will miss it because they don't really know what they're looking for. Similarly, myth number 4, hypermobility only affects your joints. It's just about the ligaments. The hypermobility can affect your entire body. So a lot of people don't realize that people who are hypermobile, way more likely to have anxiety. They also tend to be very resistant to things like anesthetic. They need much more anesthetic when they go to the dentist or have this sort of thing. Further down the hypermobility spectrum as well, it can affect the entire body. It can affect the digestive system. It's very common to have issues with hypermobility. It affects the connective tissues that affect heart rate, blood flow, things like POTS can all be related to it as well. So hypermobility is part of a package of things that can affect the entire body, not just the joints, not just the muscles and the skeleton there. Okay, myth number 5. Isn't it good to be really flexible? Flexibility has kind of become a bit overemphasized. Yes, you don't want to be stiff, and a healthy amount of flexibility is good. But if you are too flexible, and this is what happens for hypermobile people, paradoxically, you can end up stiffening up because you have a lot of tension in the muscles trying to protect those joints. So flexibility for the sake of it isn't good. You need to be as flexible, flexible enough to do the things you want to do day to day without that stressing your system. That's great, but not all of us want to necessarily be acrobats or contortionists. So chasing flexibility for the sake of it isn't always a good idea. Okay. Myth number 6 is, if you're hypermobile, you have to maintain perfect posture. You must always work on your posture. You must always focus on your posture. This is one of the most damaging ones because most people don't have perfect posture and most people aren't really able to sustain this perfectly upright position all day. What that does is it recruits way more muscle activity and that takes overworked muscles and it tires them out even more for hypermobile patients. The truth is, posture doesn't play that big a role in hypermobility. It plays a role, but it's not the be-all and end-all. And I've seen plenty of patients who are hypermobile who don't have great posture, but have healthy, strong spines and joints and muscles that allow them to do everything all day, every day, and not have issues in the future. If that's the case, we don't need to worry about posture so much. So you don't need to get obsessed about it. It's really a case of getting stronger, getting things more stable, and getting things balanced. Which leads us to myth number 7. Hypermobility, you just need to get stronger. You just need to go down the gym and lift some weights. That's a really good part of it for many people, and certainly building muscle strength is a key part of managing hypermobility. But saying that's all you need to do misses so many other issues that people often result in stiffer areas in their spine because they've had weakness and instability in other areas there. So many people's upper thoracic spines, the upper back, is very stiff in hypermobile patients. That needs freeing up to go and safely exercise. So sometimes it does need a bit of freeing up and some hands-on care to get you to do the strengthening work. Similarly, hypermobile patients should not just start going to the gym on their own and just loading up weights. Now, lighter work, body weight, that kind of thing's okay. But if you want to start weightlifting and you're hypermobile, it's really important that you start by working with a trainer who understands hypermobility first of all, someone who can guide you and spot your form. Because one of the issues with hypermobility is the brain gets less feedback from the joints, so it doesn't really know where you are in space. So it's actually a lot harder to know what your form is. So having some kind of external feedback, like a personal trainer who understands hypermobility, and that's really key as well. That's fundamental to making sure you can build that strength safely in the gym. So that's the 7 myths there. We've got, chiropractic can't help. It depends on the chiropractor. You'll need surgery, joint replacements, a wheelchair. Incredibly unlikely for the vast majority of people. It doesn't affect the spine. It does. It's just harder to spot. It only affects the joints. It can affect the entire body. Many other things are related as well there. Isn't it good to be flexible? To a degree, but chasing flexibility for the sake of it is a bad idea. You have to maintain perfect posture all the time. Definitely not the majority of cases there, and it's not as the be all and end all. You just need to get stronger. That's a key part, but it's not the whole thing, and you must make sure you're doing it safely. The bonus one this is probably the time I talk about hypermobility the most in practice, is a patient comes to see me and says, oh, my XYZ last practitioner said I'm hypermobile, or I know I'm hypermobile, the last practitioner I saw spotted it. And then I check them and I go, no, you're not. You're not. You may have been slightly bendy in one area or something moved a little bit more, but when you do a thorough top-to-toe full body assessment, I can see this person is not hypermobile. And sometimes they've been worrying about it, they've been scared about it, they've been reading all this awful stuff online that's making them think, oh gosh, I'm going to end up a complete wreck. And it's absolutely not true. So just because one practitioner told you you're hypermobile, it doesn't mean that you are. I would say the majority of people who come in and tell me that they are actually aren't. They've just been misdiagnosed by a practitioner who didn't do a thorough assessment. So that's some more info on hypermobility, some common myths and misconceptions. As always, if you've got any questions about this, get in touch. We'd be happy to help.